Yeah.
Hi everybody, we're group 4. My name is Felencia.
I'm Jabril, Gregory.
My name is Courtnee Jones.
My name is Ivana.
And I'm Jolinda Stewart.
We're going to be presenting to you today issues with healthcare reform here in the United States. You might ask, why is healthcare important or significant? Well, as a result of not having healthcare, citizens are denied access to, as a result of not having health insurance, citizens are denied access to healthcare. Every hour we lose 3 American citizens. Every day we lose 75, and every month it totals up to about 2,175 Americans that we lose for not having health care. The United States is the only nation that cripples financially their citizens with high medical bills, and because they go without health insurance. The reasons they go without health insurance is because employers fail to supply them, well, offer them health insurance. Pre-existing health conditions and financial issues are the main reasons. There are over 44 million American citizens today who live without health insurance. That's 44 million people who are exposed to earlier death. 44 million people who are basically sentenced to less or improper health care.
What has been done so far to correct the problem? The healthcare law was passed, and the law includes rights and protections, insurance choices, and insurance costs 65 and older. The rights and protections include appealing your health plan decisions, patient's bill of rights. Your insurance choices include young adults coverage, affordable insurance exchanges, and the insurance cost includes lifetime and annual limits and rates reviews. The 65 and older includes Medicare drug discounts for the older people.
The Obama National Healthcare Reform Policy worked the best. It helped so many families and senior citizens and college students afford insurance better. The name of his program was the Patient Protection and Affordable Care Act. Obama expanded Medicare and he subsidized insurance. He also required insurance providers to have a certain number of required services available to patients, such as diabetes testing, cancer testing, and blood pressure screenings at no additional cost to the patients. He also eliminated deductibles and copay. He also made it so senior citizens can receive cardiovascular screenings free of charge, and he also made it so senior citizens can get discounts on their medication. And for the college students, he made it so that we can stay on our parents' insurance until the age of 26. And I couldn't exactly find which programs didn't word their names, but I do know 2 key reasons why they didn't word. Most insurance companies went bankrupt because the insurance costs were so high, and many families couldn't afford the insurance.
A couple of solutions that I feel will benefit Americans more. One solution was sell insurance across state lines. Okay, insurance for a 25-year-old male in New Jersey would cost $6 more than it would for somebody in Kentucky because of state mandates. Because state mandates drive up the cost. Introducing choice and competition, businesses could reduce business overhead. Like, they could get higher wages and hire more people. And with that, I feel with knowledge and incentive, Americans will push their insurance for cheaper but better products for them. And like, say, you have more money, so you can buy the right health insurance for you and your family. So if you was diagnosed with a serious illness, you got the money to take it. You got the right insurance to take care of it because you have a higher amount of money in your pocket. And also with hiring more people can get access to health care. So they wouldn't have that problem. Another solution, let individuals purchase health insurance with their pre-tax dollars. Because businesses do that with the pre-health dollars, but we do it with post, which makes it more expensive because insurance companies serve businesses and not patients. So this lets people buy the services and products that they absolutely need to buy or get health insurance and get taken care of if they're sick. Another one is to encourage healthcare savings accounts or HSAs. They reduce healthcare costs without rationing or like cutting Medicaid. No one really spends other people's money. Why is the issue with yours? So say, you know, you have sugar daddy or whatever, you're gonna spend his money willy-nilly, but when it comes to your money, you're gonna be more wise and smart about it. That, which is a fundamental problem of any third-party paper system, whether it's insurance companies or the government. When a third party pays for it, you don't really ask about the cost. Like, I'm on my mom's insurance, she pays it, I'm like, okay, whatever you say goes. Healthcare savings account, they encourage patients to ask, well, how much does it cost? And do I really need this test and or this medication? Because you're going to really ask, like, is this illness that serious where I need to get tested? Well, of course. But can I take care of it myself, or do I actually need someone to help me get on the right path of how to fix this illness? Healthcare savings accounts, they let patients control their own money, which decreases healthcare spending by 13%. During 2005 and 2006, traditional insurance rose 7.3% annually. Lower costs and higher deductibles plans combined with healthcare savings accounts, they rose only about 2.7% annually. So with these solutions, I feel that Americans can get better healthcare insurance and also stay alive a little bit longer.
In Washington, there was a disagreement about renewing the healthcare system. The cost of healthcare continues to rise, but the people that worry about the few choices they will have, they will feel less secure that their coverage will not be, well, the coverage they have today won't be there tomorrow. President Obama, although his leaders, they think they should expand the government control over healthcare. Individuals should also have a decision to make of what healthcare choice they want. And the end result will probably lower the cost and guarantee better quality. You had a video you want to show?
Our healthcare system needs some reform. The question is, which way should we take from healthcare reform? Liberals in Congress want to centralize decision-making in Washington, letting politicians and bureaucrats decide what's right for you. A better approach would be to allow individuals and families to decide what healthcare is best for them. Some in Congress want to create a one-size-fits-all healthcare system for all Americans. A better approach would be to allow the states to design healthcare systems that best fit the needs of their citizens. Finally, their healthcare plan is going to cost over $1 trillion and add another $1 trillion to the debt. Do we really want to saddle Americans with unknown costs and more debt?
For more information, log on.
We had many different sources we used to bring together this presentation, but the main one we used was a study that was at Albert Einstein's medical school. They surveyed first and second year students about basically what they felt about health care. 362 students were eligible to complete the survey. Only 204 did so. It was 16 questions, and it basically they just were talking about how healthcare should be a state issue and not national, because it would be, there are different financial situations in every state, so it would be unstable, you know, nationwide, countrywide. And another study we used in our discussion questions. First question that I'm going to open up with is, why do you feel that having access to health care is important? So y'all don't think that if you don't have access to health care, you're exposed to earlier death. So doing that, you lose people dying, people are sick, they're not able to work. So y'all don't think that'll play a...
We can't hear you.
Okay. Why do you feel that having access to health care is important?
Because some people can't like afford to pay for health insurance. So, okay, it's good for those people who need the help.
So do you think that health care should be like an individual responsibility, or do you think that it should be everybody should have access to it, like the government should be the primary funder for health care?
What do you think?
They probably should.
We got families that, you know, aren't financially stable.
Yeah, except it's like, I guess you can put an exception for the families who are not financially stable. And the families who are wealthy should be able to pay for their own services.
But this is what we have in the country right now. For the poor family, we have, Medicaid, health choice for children, right? Right. For older individuals, we cannot